Every year in my intensive care unit, I admit hundreds and thousands of children with infections, pneumonia, injuries, and multi-organ failure. So being an intensivist, I rely on the monitors in my ICU that beep, alarm, and sound when the condition of a child is deteriorating. But with every admission in my ICU is accompanied by a parent who says, "Doctor, my child is not well," much before the alarms sound. And most of the times, these parents are right. So today, I'm going to raise a question. Can parents detect danger in a child much before the ICU monitors? Yes, they do. And if they timely recognize and timely intervene, they can save precious lives of their children by a three-step framework. The first is recognition. Recognition, now child's body has tremendous capacity to compensate. Their blood pressure, heart rate, and the oxygen saturation falls at a much later stage when they are very ill. So any parent who can detect subtle danger signs in a child and timely intervene can save the precious lives of their baby and prevent them from landing in ICU in a serious condition. So for example, they can pick up simple physiological signs like their child is not breathing well, the child is lethargic, is not taking well properly, and is not playing, and he's not being his usual. So if you pick up these danger signs, you save a lot of problem. Now, this is not insight. This is hundreds of thousands of years of experience, and that a parent observes his child for so many years and their expertise. Few months back in the rainy season, a mother came to me saying, "My child is not well. Doctor, he's sleeping more than his usual." So when I checked the vitals, everything was perfectly fine. But on her perseverance, we uncovered the child and we found the fang marks of a snake. So it was the mother's instinct that helped us recognize the problem early. We could treat the child without him landing into the complications. So the parents are our 24/7 monitors, which act at home, and they help us saving the lives of their children. Second, action. Now, a diligent parent or an intellectual parent will not panic in an emergency situation, will handle the situation diligently, and give first aid to their child with the skills and knowledge they have. For example, giving adrenaline injection in a severe allergic or anaphylactic reaction, giving paracetamol for fever, giving fluids to a dehydrated child, or giving Heimlich maneuver in case of choking. So what is this? This is pain to power, panic to action. So in this situation, if the parents act in time, they can save a lot of trouble in the ICU, and they determine the story which happens in our ICUs. For example, few months back, a father saw his child in an unconscious condition outside the gate of his house. There was a live wire which was, hanging around the body of this child. So he was a healthcare provider. He immediately removed that wire and started doing cardiopulmonary resuscitation, CPR, on his pulseless child. So what happened? He got the baby to our ICU. We took over and took the child on life support systems. But it was the diligence, the intellectual, and the skill of the father that helped us save that life. So if the parents, they are intellectual, they know what to do, we can save a lot of precious lives with the parents hand in hand. Another important question which comes with the parents is where to take your child in case of an emergency. Now, not all hospitals deal with childhood emergencies. Not all hospitals have pediatric intensive care units. So if you have a mobile number or an emergency number of an hospital that deals with sick children, you save a lot of time which we lose in transporting the child to a hospital where appropriate action can be done. Unfortunately, most of the mishappenings occur because of the delays in recognition, delay in action, and delay in choosing the right place. Finally, very important, prevention is better than cure. Now, an intelligent parent will have a safe environment at home, a safe house, a safe school. For example, keeping drugs and medicines in cupboards away from the children. Keeping secure your kitchens and bathrooms so that children can be prevented from drowning, fire, or any other thing. So, important is that you keep your homes and your schools safe for children. Now, here I have two messages to give to the parents. One, for the parents that see, trust your instinct, trust your observation. Do not work in fear, but work in hand with the doctors to save lives and save time. Nobody knows your child better than you do. And if you act in time, you can save a lot of lives. And for the doctors, my fellow doctors, if we want lesser children in our ICU, you have to acknowledge the basic instinct and intellectual parent. And because before any beep in my ICU, a parent would have already raised the alarm. So the critical care doesn't begin in ICUs. It begins in the arms of the parents. It begins in the classrooms. It begins at our home, where parents are the first critical care responders. And if they know what to do and what to act, they can save a lot of lives with us. And we intensivists want to have an era where parents are not just the visitors to the healthcare system, they are the first critical care responders of our team. And join us hand in hand to restore the precious smiles. Thank you.